Okay, let's unpack something that might feel a bit technical at first. This idea of R squared. You hear it in like economics, statistics,
Right, numbers stuff.
yeah, number stuff. But trust me, the implications, they ripple out
Yeah.
into the real world. Sometimes, honestly, it touches on life and death.
Hmm.
You see, I was thinking about my uncle in Siamis, more rural part of Indonesia. He passed away a while back.
Oh, I'm sorry to hear that.
Thanks. But the thing that was so heartbreaking was,
Yeah.
well, the reason behind it. His family, they were terrified of the hospital bills.
Right.
They didn't have BPJS, the National Health Insurance.
Things BPJS.
And you hear these figures, right? Like BPJS coverage is almost universal now, 80, maybe 90%.
That's the claim, often. Near universal.
But the reality on the ground, it can be so different. Even if you're technically in the system, sometimes outstanding debts mean you can't get treated.
Yeah, access gets blocked. The security isn't actually there.
Exactly. It highlights this huge gap, between the big stats and, well, people's actual lives. So how does a statistical thing like R squared even begin to connect to a story like that? It sounds weird, I know.
It does sound like a leap initially, but it's actually quite profound how these seemingly abstract concepts end up woven into the fabric of something as basic as healthcare access, especially in a place as vast as Indonesia.
Makes you really question what those big numbers mean for individuals.
Definitely.
And, speaking of big numbers affecting people, let's switch gears just a little bit. KIPI Kuliah, Indonesia's program for student tuition aid.
Yes, KIPI Kuliah, important program, helps students from less well-off families get to university, covers tuition.
Right, and here's the first piece of our puzzle. Getting that help. It partly depends on something called the DESL.
DESL. Okay, yeah. For those listening who haven't run into this term, DESL is basically how the Indonesian government ranks families based on income or, well, usually expenditure as a proxy for income.
How does that work exactly?
Well, imagine lining up every single household in the country. Poorest on one end, wealthiest on the other. Big, long line.
Okay, got it.
Then you just divide that line into 10 equal chunks, 10% each. The first chunk, the poorest 10%. That's DESL 1.
The very bottom.
The very bottom. The next 10% is DESL 2, then 3, and so on, all the way up to DESL 10, the wealthiest top 10%.
And KIPI Kuliah, it's aimed at the lower end.
Primarily, yes. DESLs 1, 2, and 3. That's the main target group for the assistance.
What's interesting, though, is how visible this DESL thing is for KIPI Kuliah anyway. We found this YouTube clip, right?
Oh, yeah?
Showing students how they can literally just check their family's DESL on the KIPI Kuliah website or maybe an app.
How to do that?
Just punch in their student ID number and their family card number, and boom, it tells them DESL 4, DESL 2, whatever.
Huh. Pretty straightforward access to that specific piece of information.
Yeah, it is. Which kind of makes you wonder then, how is eligibility decided for other really crucial programs, like, the healthcare support my uncle needed? How do they figure out those DESLs?
That's the million-dollar question, isn't it? And it points to the enormous scale of the data collection that's going on behind the scenes for these social programs. Think about Susamis.
The National Socioeconomic Survey.
Exactly. The data we're sort of digging into here. It comes from a survey of, get this, 1.2 million people.
Wow. 1.2 million. That's huge.
It's massive. This isn't like a quick political poll of 1,000 people. This is a statistically representative sample. Huge confidence in the findings because of that scale.
Okay, so using this big Susanis data set from March 2024, our source actually did some digging into KIPI Kuliah.
What did they find?
Well, first, they identified the students, people aged like 18 to 24, enrolled in higher education. And guess what tiny slice of Indonesia's population that actually is?
Oh, I bet it's small.
Tiny. About 2.46%, which, based on the data, works out to maybe 6.8 million people.
So a relatively small group overall, university students.
Yeah. Then they looked within that group in the sample. How many said they were getting KIPI?
Oh.
And the estimate, once you weighed it for the whole country, was around 500,000 students receiving KIPI nationwide.
500,000. Okay. Which brings us back to that key question.
Is it going to the right people?
Exactly. Is KIP actually reaching the students it's supposed to? According to those DESL targets, is the money flowing to DESLs 1, 2, and 3?
Right. So to figure that out using Susanis, you first need to put everyone in Susanis into their correct DESL.
And how's that done in practice with the survey data?
Well, the standard way usually is looking at per capita household expenditure.
Expenditure, not income. Why expenditure?
It's often seen as more reliable or maybe easier to measure accurately in surveys than income. especially in diverse economies. And per capita just means you take the household's total spending,
On everything. Food, rent, transport.
everything, and divide it by the number of people living there.
Right. So it accounts for household size. A big family spending the same total amount as a small family is actually less well off to purser.
Precisely. Helps level the playing field. And just for context, in that 2024 data, the average monthly spending per person was about 1.6 million rupiah.
Okay, so you calculate that for everyone in the Susina survey, all 1.2 million.
Yep, then you rank them. Lowest per capita expenditure up to the highest.
And then divide into 10 equal groups.
Exactly. That gives you the true decils based on the survey's detailed expenditure data. Usually done with statistical software, of course, Stana was mentioned, handles the big numbers.
Makes sense.
Yeah.
So what did they find when they compared the KIPI recipients to these calculated decils?
Okay, now here's where it gets, well, really surprising.
Yeah.
Maybe even a bit shocking.
Uh-oh.
When they crunched the numbers,
Uh-huh.
the decil with the highest number of KIPI Kuliah recipients in that 2024 sample was decil 10.
Wait, decile 10, the wealthiest 10%?
The wealthiest 10%, yeah.
Mhm.
About 82,000 students based on the weighted data.
Wow. Okay, that's not what you'd expect or hope for, really.
Not at all. The wealthiest getting the most aid, it immediately, like you said, makes you question the targeting. How is this happening?
Yeah, it flags a pretty big issue. If the goal is helping the poorest, that result is, well, it's upside down.
And then there's the flip side, equally worrying, what they call exclusion error.
Meaning people who should get it, but don't.
Exactly. The data showed a really significant number of students who were actually in decile 1.
The poorest of the poor.
The absolute poorest did not get KIPI, around 270,000 of them, based on the data.
Nearly 300,000 students in the most need, potentially eligible, but missing out. That's huge.
It's huge.
Yeah.
So why? Why this mismatch? Why are the wealthiest getting it and the poorest missing out?
Well, there could be various factors, maybe a data inaccuracy somewhere along the line.
Sure.
But a core part of the puzzle, and this is where R² starts to become really relevant, is how the government figures out these devils in the first place. Not just for KIPI, but crucially for healthcare, too, for BPJS.
Okay, so how do they do it for the big programs?
It relies heavily on something called the DTKS.
DTKS, that stands for Data Terpadu Kesejahteraan Social.
Exactly. The Integrated Social Welfare Data. Think of it as the government's master list or registry. It's used to determine who's eligible for a whole range of social aid programs. Back in 2013, for instance, it had data on something like 135 million people.
Whoa. Okay, massive database.
Massive. But here's the critical limitation.
What's that?
For most of those 135 million people, the DTKS doesn't have direct, up-to-date information on their income or their expenditure.
But we just said income or expenditure is what you need to calculate decils properly.
Precisely. So if the main database they use for targeting doesn't have the key ingredient, how do they assign the decils?
Good question. How?
They use a statistical workaround. It's called Proxy Means Testing, PMT.
Proxy Means Testing, okay? Sounds technical again.
It is a bit, but the idea is fairly simple. Since they can't constantly survey everyone's income,
It's just too expensive, too difficult for 135 million people.
exactly. They use a statistical model to predict it instead.
Predict income or expenditure. How?
Okay, think of it like building a recipe. They take a smaller, richer data set like Susina's, where they do have detailed income or expenditure data.
The data we were just talking about.
Right. And that survey also has lots of other information about the household. How many people live there, their education levels, what the house is made of. Do they own a motorbike, a fridge, livestock? You know, observable stuff.
Okay, assets and demographics.
Yes. So they use statistics, specifically regression analysis on that smaller Susina's data set, to figure out the relationship between those observable things, assets, demographics, and the actual income or expenditure.
So the model learns, like, families with tiled floors and a motorbike tend to have higher spending, that kind of thing.
Exactly. It learns those patterns. It calculates the statistical weight or importance of each factor: floor type, roof type, education, assets, and predicting expenditure.
Okay, so it builds this predictive recipe from the detailed survey data. Then what?
Then they take that recipe, the learned relationships, the coefficients from the regression model, and they apply it to the huge DTKS database.
The one that only has the observable stuff, the demographics and assets.
Correct. The model takes the asset and demographic info for each person in the DTKS and uses the recipe to predict what their income or expenditure would be.
So it's an estimate, a statistical guess, almost.
It's a statistically informed prediction, yeah. And that predicted value is then used to rank everyone in the DTKS and assign them a decile.
Okay. I think I'm starting to see where R squared fits in now.
Exactly. This is it. R squared is the measure of how good that recipe is. How well does the statistical model, using those observable characteristics, actually predict the real income or expenditure?
So it's like a score for the prediction model.
Pretty much. It's a score between 0 and 1, and R squared closer to 1 means your model is great. The observable stuff explains a lot of the variation in spending. Your predictions are likely to be quite accurate.
And closer to 0.
Closer to 0 means your model is weak. The assets and demographics don't do a good job predicting spending. There's a lot of guesswork, a lot of error in the predictions.
So a higher R squared means potentially more accurate DESL assignments in the big DTKS database.
Generally, yes. We'll come back to what high means in this context, but it measures the model's predictive power. How much of the difference in people's economic status can we explain with the data we have? An R squared of, say, 0.6 means we can explain about 60% of the variation, but 40% is still unexplained, due to factors the model doesn't capture.
Right. Okay, so let's pull this back to where we started. Healthcare. My uncle.
Yes. This whole PMT process, predicting expenditure, assigning DESLs in the DTKS, this is absolutely critical for determining who gets PBI.
PBI. Penerima Bantua Iran. The people whose BPJS health insurance premiums are paid by the government.
Exactly. They are identified as eligible primarily based on being in the lowest DESLs within that DTKS database.
So, if the PMT model used to create those DTKS DESLs has a low R squared, if the predictions aren't very accurate,
then the DESL assignments in the DTKS could be wrong for a lot of people.
meaning people who are actually very poor might get predicted as being better off.
And therefore miss out on PBI. They get excluded.
And people who are actually better off might get predicted as poor.
And potentially receive PBI when they shouldn't. That's inclusion error.
Yeah, okay. That connects the dots. The accuracy of that statistical prediction, measured partly by R squared, directly impacts who gets life-saving healthcare support.
It really does. And we've seen tragic real-world stories that seem to reflect these potential errors. You mentioned your uncle. There was the case of Rusamala Dewey in 2017.
Yes, I remember reading about that. She had cancer, clearly impoverished, but couldn't afford BPJS, wasn't getting the government help.
A terrible situation. And another story, Yayu, who reportedly died because treatment was delayed, her government-paid BPJS, was apparently inactive when she needed it.
These aren't just stats. It's devastating.
It highlights the real human cost when these systems don't work perfectly.
So if we look back at the data again, maybe around that time, 2017, does it show issues with PBI targeting too?
Yes, the source looked at the 2017 Susinas data as well. At that time, about 71 million people were receiving PBI.
Yeah, large number.
And while overall health insurance coverage was around 60% of the population, which sounds okay.
What?
But when you look at the poorest DESLs, based on the Susinas expenditure data, there were still huge gaps. In DESL 1, the very poorest, something like 44%, had no health coverage at all in 2017. None.
Nearly half of the poorest were completely uninsured, even with PBI existing.
Yeah, significant exclusion happening, and just like we saw with Kipikulia.
Let me guess, PBI recipients were showing up in the wealthiest DESLs.
You guessed it. A noticeable number of people receiving government-paid PBI in 2017 were actually in DESL 10, according to the Susinas data.
The wealthiest group again.
Yes. There was even that controversy around celebrities, Harvey Mose and Sandra Dowie, allegedly being listed as PBI recipients at one point. Whether true or not, it points to the perception and potential reality of inaccuracies.
So again, this dual problem, exclusion of the genuinely poor and potential inclusion of the non-poor.
Exactly. Resources potentially misallocated while those most in need are left out.
Did the government acknowledge this?
They have. It's important to note that. In 2019, the Ministry of Social Affairs actually announced they were deactivating PBI for about 5.2 million people who were deemed incorrectly targeted.
Oh, wow. 5.2 million.
Yeah, significant number. And the plan was to replace them with people identified from DESLs 1 and 2 in the DTKS. So there's definitely awareness and effort to improve the targeting accuracy over time.
That's good to hear, but it shows the scale of the challenge they were facing.
Absolutely.
Okay, this is fascinating, but also quite complex. You mentioned the source put together a simulation to show how this PMT and R squared thing works in practice.
Yes, exactly. To make it a bit more concrete, they set up a technical demonstration using simulated data. And for anyone listening who wants to follow along, maybe on a laptop, the data is actually available.
Oh, cool.
The link is Tinero.com make a set. TINERO.com/EIKASET.
Got it. And what's in that download?
You get a couple of data sets. One is a sample based on the 2013 Susina survey. The other is a simulated DTKS dataset.
Okay, simulated DTKS, what's in that?
It has the kind of variables the real DTKS would have: demographics, housing materials, asset ownership, education levels, that kind of thing.
But crucially, no actual income or expenditure data.
Exactly. That's missing, just like in the real DTKS for most people. But then the Susina's 2013 sample does have all those same demographic and asset variables, plus it has the actual expenditure per capita data for those households.
Okay, so you've got the poor data like DTKS and the rich data like Susina's.
Kind of, yeah. So the first step in the simulation is to build that predictive model, the regression, using the Susina's 2013 data.
Using the rich data to create the recipe.
Right. The goal is to predict the logarithm of expenditure per capita based on all those other variables, housing, assets, etc. Again, using statistical software like Stata.
And what kind of R-squared did they get in this simulation? How good was the recipe?
In this particular example, the R-squared came out at 0.64.
0.64. Okay, is that good? Bad?
Oh, yeah.
Average? For this type of data, what we call cross-sectional data, 0.64 might actually be considered reasonably decent by some standards. It's not uncommon.
Okay.
But, and this is the crucial point, even at 0.64, it still means that 36% of the variation in people's spending is not explained by the model.
Right, the missing ingredients we talked about.
Exactly. And that unexplained part directly translates into prediction errors when you apply the model to individuals. Even a good overall fit can still misclassify a lot of people at the individual level.
Okay, so they build the model with R-squared 0.64 using Susina's. What's next?
Next, they apply that trained model, that recipe, to the simulated DTKS data, the data set that was missing the expenditure info.
To predict expenditure for everyone in the simulated DTKs?
Correct. It generates a predicted expenditure value for each person, and from those predicted values, they then create the decils ranking everyone based on the prediction. So now you have predicted decils for the whole simulated DTKS population.
Yes. And then the simulation demonstrates how social assistants, they call it BANSOs, might be targeted using these predicted decils.
Like the KPA, PBI targeting in real life.
Exactly. They simulate two scenarios. BANSOS 1 targets the predicted decils 1, 2, and 3, the bottom 30%. And BANSOS 2 is more narrowly focused, targeting only predicted decil 1, the bottom 10%.
Okay, makes sense. But how do we know if this targeting actually worked? How do we see the errors?
This is the clever part of using a simulation. Because it's simulated, the creators also have the actual true expenditure data for everyone in the simulated DTKS hidden away.
The ground truth.
Exactly. So they can compare who should have received BANSOS based on their true decil, calculated from the real expenditure, versus who did receive BANSOS based on the predicted decil from the PMT model.
And that lets them measure the exclusion and inclusion errors directly.
Precisely. They can see exactly how many people who were truly poor were missed by the program because the prediction was off.
Okay, so what were the results? How bad were the errors, even with that R-squared of 0.64?
The results are, well, pretty sobering. For BANSOS 1, the program targeting the poorest 30% based on predicted decils,
Yeah.
about 35% of the people who were actually in the poorest, 30%, were excluded. They didn't get the aid, even though they were truly eligible.
Wow, 35%. Over a third of the intended recipients were missed.
Yep. And it gets worse. For BANSOS 2, the program targeting only the very poorest 10%, predicted decil 1, a staggering 58% of the individuals who were actually in the poorest 10% were excluded.
58%.
58%. More than half of the very poorest group, the most vulnerable, were missed by the program designed specifically for them, just because the PMT prediction wasn't accurate enough at the individual level.
Good grief, that's genuinely shocking. Even with an R-squared that sounded kind of okay, like 0.64,
Yeah.
the targeting error for the most vulnerable group was over 50%.
It really drives home the point. That headline R-squared number doesn't tell the whole story about individual accuracy.
And just let that sink in. Scale that up. If these kinds of error rates are happening in real life, even approximately, you're talking about potentially millions of the poorest Indonesians being excluded from vital support.
Millions missing out on education aid, on healthcare subsidies.
Thinking back to my uncle,
Yeah.
Rasamala Dowie. Yeah, you. It puts those individual tragedies into a much broader systemic context. The limitations of the statistics, the models, they have these incredibly profound real-world ethical consequences.
Absolutely. So I think the core message, the big takeaway from this deep dive is that the seemingly abstract number, R squared,
This thing economists throw around.
yeah, it's not just a technical detail. It carries immense ethical weight when it underpins systems that decide who gets essential help and who doesn't, especially in life or death situations like healthcare.
It really highlights that trade-off, doesn't it, between how well a model fits the overall data, which is what R squared measures,
And how accurately it predicts things for each individual person.
and even a model that looks good on paper, with a decent R squared for this kind of work, can still lead to massive errors at the individual level. It can systematically exclude the very people it's supposed to help.
It really forces you to confront the immense challenges of poverty targeting, doesn't it? Especially when you lack perfect real-time income data for everyone. PMT is a pragmatic solution in many ways, but it comes with these inherent limitations and potential costs.
It definitely does. And it really leaves you thinking, well, what are the alternatives? Are there ways to improve this? Better data, different models, maybe combining methods. It's clearly not simple.
No easy answers. But understanding how these systems work, understanding the role of things like PMT and R squared is just so crucial. It's crucial for holding policymakers accountable, for evaluating whether social programs are truly effective and fair.
Yeah, it connects the technical stuff directly to the human impact. Knowing this helps us ask better questions about the policies that shape millions of lives.
Couldn't agree more. It's about seeing the people behind the statistics.